Today, a new treatment for depression that's unlike anything you've probably heard of before, and it's showing good promise. And here's something very positive about it. It does not affect memory loss, alertness, or other body systems like medication.
Yeah, here to explain something called Transcranial Magnetic Stimulation are doctors Jeffrey Taxman and Bernadette DeMuri. Thanks for being here.
Thank you for having us.
Yeah. Let's talk about this. So the short letters for it is TMS. Let's talk about what that is and exactly who is a candidate for it.
Well, as you probably know, depression is a very serious illness, and people that are very depressed find it interferes with their life, their family, their work. And until now, we've pretty much been relegated to drugs or psychotherapy. About 5 years ago, the FDA approved a new treatment called Transcranial Magnetic Stimulation. Using that, we can get the brain more active. In a depressed brain, as you can see on the illustration, there's much less activity in the limbic system, or the area that's responsible for emotions.
So the top one there is the depressed brain?
Correct. With TMS, we can stimulate an area in the dorsolateral prefrontal cortex. It's a part of the brain in the upper left that then gets the emotional system more active.
A lot of people are familiar with electrical shock therapy is what it's called. I know there's actually a different name for it. Is it different than that?
It is. You're referring to ECT, electroconvulsive therapy, which has been used for many years. They're both effective forms of treatment of depression, but they're widely different. The differences are that TMS is very local, so it just stimulates one part of the brain, as Dr. Taxman mentioned. With ECT, it involves anesthesia, so you have to go into the hospital or an outpatient surgery center, be put under with general anesthesia. Your muscles are paralyzed, and you're given given electrical stimulus to induce a seizure. So it's a higher risk procedure. There's also some memory loss that can occur, both short-term and sometimes long-term, and you need more caregiver support. So you really need to be driven there, taken home. With TMS, it's very local, very non-invasive. You can drive yourself to the treatment, and you can drive yourself home. You're not sedated. Very, very different type of treatment.
And when you're talking about magnetic, is it safe? Are there side effects? Clearly there are side effects to the ECT. Are there side effects to this?
Well, as with any treatment, there are side effects, but TMS is incredibly safe, especially compared to our other treatments for depression. So the major side effect is scalp tenderness. We stimulate right over this area of the brain, as Dr. Taxman mentioned, and it can hurt a little bit, especially in the first week of treatment. We have people maybe take some acetaminophen or ibuprofen, and that can cut down on the pain. After about the third or fourth treatment, however, they really get used to it, and they're really not complaining much of any painful side effects. The only major medical side effect would be the risk of having a seizure, which is also very low. It's about 0.1%, which is about the same risk of seizure as when you take antidepressant medications. The seizure would occur in the chair. It wouldn't occur outside of the center. And fortunately, both Jeff and I have never had a seizure in either of our centers. So.
We've talked before with people on our show who are resistant to a lot of forms of medication and other treatments, and so it brings up the question, who's a good candidate for this particular type of treatment?
Well, the FDA approved TMS for treatment-resistant depression, and that means you've been on an antidepressant and failed and have not had a good profile, a good response profile to that medication. So those are the primary FDA-approved patients. There's other populations, though, that we think are very good choices. One would be nursing women that might have postpartum depression. They may not want to take medication or should not because of the possibility of passing that on to the infant. There's other groups such as chemotherapy patients and cardiac patients that are taking complex medication regimen, and we don't want to add another medication because it may affect the levels of those meds.
And you really feel that this can be changing the face of psychiatric care for so many people who need help and aren't finding it in other ways. In terms of dealing with it as an integrated therapy, you really feel like this is a good integrated type of process. What do you mean by that?
Well, the title of our TMS clinic is Integrated TMS. We incorporate at our clinic a specially designed modular therapy program, one session with each week of the therapy. And we combine therapy specially designed for that patient with the treatment. And we've found that that both helps the patient understand their depression, what it's done to them, as well as the therapy that they're undergoing right then. We've also been seeing, and I think Bernie may have similar results, that TMS seems to help with somebody's ongoing therapy, whether it's with us or with another therapist.
And quickly, can it be a long-term a fix or cure treatment, or is it something that people need on an ongoing, regular basis?
That's a good question. The great majority of folks will go through the typical course of treatment and will have long-lasting results, although it's a new treatment, so many of the studies have not been extended beyond a year. But anecdotally in our clinic, and I'm sure Jeff can speak to that too, the great majority of patients don't have to come back. When they do, it may be a much shorter treatment, or it may be a couple of just booster treatments over time.
I think it's wonderful for people who are suffering and want help, or their current treatments are not working as well. Here's where you can find more about TMS. There's the Glen Oaks location in Mequon, or the North Mayfair Road location in Wauwatosa. The phone numbers respectively are on your screen as well for each location to find the one nearest you to learn more about TMS and if you are a good candidate for treating your depression. Thanks so much for being here, doctors.
Thanks
we appreciate
for having
it.
us.
Thanks.
Great to have you both. Thank you so much.